My objective is to talk about epilepsy this morning, and I'm going to start off with talk about the basics of epilepsy, a bit of an overview, and then we're going to talk about the effects of epilepsy on growth and development. So this is Epilepsy 101. This is the basics. What is a seizure? What is epilepsy? And how do we treat epilepsy? And the slide to the left there is just a picture I found off Google representing a brainstorm, which is one way to think of a seizure, because it's an electrical discharge from the brain. So what is a seizure? A seizure, clinically, to a person that you're looking at or talking to, is a sudden change in awareness, behavior, or a sensation. And it is due to an abnormal discharge of a brain cell, which we call the neuron. And this is just a diagram of the neuron. There are chemicals that excite the neurons and chemicals that inhibit the neurons. And when you have a lack of inhibition or a lack of breaking of the neurochemicals, we have a seizure. So that's the basics of what a seizure is. The manifestations of a seizure depends on where in the brain the seizure is coming from. So if you have a seizure starting from the motor area, you may have movements of an arm or leg. If you have a seizure starting from the sensory area, you may have a funny sensation of an arm or leg. I had a patient once who described seeing ants all over the left side of her body, and we did the EEG. We discovered that she was having a seizure coming from the sensory area of the opposite side of the body. If you have a seizure coming from the occipital area, which is the back of the brain, the visual cortex, you may just have a visual sensation. So a seizure depends where in the brain it's coming from. There are different types of seizures. There are generalized seizures, and generalized seizures come from the entire brain all at once. And there are about 4 basic types of generalized seizures. There are absent seizures, tonic-clonic seizures, myoclonic seizures, and atonic seizures. And I'll go through these again in a second. But those are the major types of generalized seizures. Again, they involve the entire brain all at once. And then there are partial seizures. Partial seizures, we also will call them focal seizures. They may begin in just one part of the brain. If they stay in one part of the brain and don't spread to the surrounding area, it may be a simple partial seizure. With a simple partial seizure, you're aware, you can talk, you remember what happened, you can describe seeing the ants on the side of your body. If it's a complex partial seizure, the seizure spreads a little bit, and at that point might involve loss of memory or loss of consciousness, and you won't remember the seizure. And then there are seizures which have, we call it secondary generalization, and that's when the seizure starts at a small area, then spreads to involve the entire brain, and you might have a generalized tonic-clonic seizure. Dr. Tatum has some pictures later on of some videos of some seizures, so you get to see what a seizure actually looks like. This is just a picture of a generalized tonic-clonic seizure. The old term for that is a grand mal seizure. There's a tonic phase when the muscles tighten and stiffen, and there's a clonic phase when the body actually jerks. This is compared to an absent seizure, which is also called a petit mal seizure. Petit mal is an older term. With a petit mal seizure, the patient or the child is typically perfectly awake and alert, and all of a sudden, for 5 to 10 seconds, will space out, may flutter their eyes. Those 5 to 10 seconds are lost to the patient, and after those seconds, the patient returns to full awareness. Those are just some examples of different types of seizures. How common are seizures? And this is interesting. 10% of the population at some point in their life will have a seizure. It's most common in young children and in the elderly. And the highest incidence is actually under age 2, probably because a lot of febrile seizures at that age group. But so seizures themselves are common. Now, seizures should be distinguished a little bit from epilepsy. Epilepsy is a very common, probably the most common neurological condition, which is characterized by recurrent. Recurrent means more than one. Unprovoked seizure. Unprovoked means normal blood sugar, normal fever, no obvious cause for the seizure. When you have a pattern of seizures, when you have recurrent seizures, then we use the word epilepsy. And some doctors will say seizure disorder, some will use epilepsy. Sometimes that's just a little bit of wordsmithing, but it's all about the same thing. So one seizure all by itself is typically not considered epilepsy. And what's confusing about epilepsy is there are many different types. We went through the slides of different types of seizures. There are also many different types of epilepsy. How common is epilepsy? Now remember, 10% of the population will have a seizure at some point in their life. 1% of the population has epilepsy. So in the United States, there are 3 million people, and it can start at any age. This is just a slide of the Jaguar Stadium. This is obviously its stadium is full, so it's not a Jaguars game. It's probably the Florida-Georgia game or a monster truck show. But I think the Everbank Stadium holds 80,000 people if it's full. So if it's that many people, 10% or one section will have a seizure at some point in their life. And 1%, perhaps the blue area, will actually have epilepsy. So if you go to a Jaguars game or the Florida-Georgia game, and there are 75,000 people, probably there are at least 700, 800 to 1,000 people who actually have epilepsy. So it's a very common disorder. There are many causes of epilepsy. This slide talks about all the different possibilities. Some of these are very rare, and some of these are more common. In children, we see a lot of idiopathic epilepsy, and we'll talk about that again in a second. Other common causes might be brain trauma, so if they've had a car accident or a head injury, they may, 1 year or 2 years later, actually have seizures from that. Everybody worries about a space-occupying lesion, which is like a tumor. Very uncommon in kids, and the elderly, we worry a bit more about that. But there are a lot of different causes of epilepsy, and the neurologist's job is to define, okay, you had a seizure, why did you have a seizure, and do you have epilepsy? And for that, we use MRI scans, CAT scans, and EEGs, as well as talking to you and trying to examine the patient. The causes of epilepsy that I see most commonly in child neurology are typically idiopathic. And the other word for that is cryptogenic. So idiopathic is a way of saying the doctor's an idiot, patient's pathetic. But it really means that there's no identifiable cause for the patient's epilepsy. We know that there's a neurochemical imbalance. We know there's an electrical problem within the brain, but the patient is otherwise healthy and neurologically normal. You do a CAT scan, MRI scan, you don't see any lesions. The patient has a normal exam, but nevertheless, they've had one or more seizures. And in that case, we call this idiopathic. And that's actually very good. Some parents come to me and say, my child's having epilepsy. There has to be a reason. Why is he having seizures? And the good answer is there's no obvious reason. And sometimes that could be genetic, or sometimes it could just be he was born with the tendency. But that's actually the best type of epilepsy there is, because that's the kind that's typically outgrown. So we actually like the idiopathic epilepsies. Cryptogenic is also kind of a medical term that means there's a hidden cause, we just can't find it on an MRI scan. The other term we sometimes use is an epileptic syndrome. And an epileptic syndrome is a disorder that we characterize by signs and symptoms of the patients that occur together. This might include the type of a seizure, like an absence seizure. It will include the EEG findings, and some syndromes have a typical EEG pattern. The cause of a seizure, perhaps idiopathic. The age of onset, infant, elementary school child, or a teenager. And the course, or what happens over time, and how well do they respond to medications. These are the more common epileptic syndromes. And when you see a neurologist or an epileptologist, we try to see if we can't put you together in a syndrome. If you can say you have a syndrome, then we can predict what's going to happen a little bit better. Cognitive deficits in epilepsy. As a broad group, in a general sense, people with epilepsy tend to have impaired cognition, impaired IQ. However, there's a lot of variability, and many patients have normal intelligence or superior intelligence. Epilepsy affects people of all different types. So we look at the causes of the seizures, the age of onset, how frequently they're having seizures and how severe they are, and what medications they're on. Again, medications like phenobarbital, dilantin may have a greater effect on cognition. The newer medications, we think less so, but probably they too have some effect on cognition and memory, depending on how carefully you test for that. Emotional and behavioral. As we all know, epilepsy is a chronic disorder, and it's unpredictable. It's frightening, and it's poorly understood by the general public. A lot of stigma, a lot of misperception. It disrupts the dynamics of the family. Parents might feel guilty. They may overprotect their child. Siblings may be jealous, and the patient may feel rejected. So a lot of stuff that goes on with epilepsy besides just the seizures. Psychiatric disorders are also much more common. Anxiety, depression, hyperactivity, aggression, suicide. You know, it's sad, but there's a higher incidence. The medications we use may affect the mood, some of them in a positive manner and some of them on a negative manner. Many of the anticonvulsants are used by a psychiatrist for mood control. Lamictal, Depakote, carbamazepine, trileptal have some mood stabilization properties. Others, like phenobarbital, Keppra is well known for activating, perhaps inducing some mood changes. And finally, kind of the social issues of epilepsy. Again, there's a stigma with epilepsy. It's not understood well by the public. There's concern for participation in sports and social activities. Parents may be reluctant to let the child go out to the prom, go out with their friends, or participate in sports, and that impacts their social development. Poor self-esteem, negative self-image, embarrassment, big issues. Feeling isolated, feeling different, can't do sleepovers. Sleepovers are a big deal when you're 10 years old. Summer camp, you know, something we all did when we were little. It's very hard if your child has epilepsy. I'll come back to that in a second. And adults, marriage, driving, employment, insurance, all a problem. This is just kind of my final slide. That the chef knows this well, but there's a camp in town, near Orlando called Boggy Creek, where children with epilepsy can go spend a week and be a normal kid, stay up late, have campfires, ride horses, and this is a great event. The EFA sponsors this every year, and patients go free of charge. So if your child has epilepsy, this is a great thing to take advantage of and talk to your doctors about. And this is kind of my final slide, emphasizing that, you know, we need to increase the awareness of epilepsy. It's a condition, it's not a disease, and most people with epilepsy lead normal lives.